the first question people always ask is, what is psychological trauma? So I say psychological trauma, we mean that the person who has suffered, a person who has suffered some form of emotional strain or who has experienced something deeply distressing. And by virtue of that experience, that person begins to feel overwhelmed by the experience and also feels that the resources or the coping strategies he or she uses are either not sufficient or maladaptive. So if I say not sufficient, it means that the person tries to cope, but the coping strategy the person is using is not helping the person gain the benefits that he or she expects. And then when I say maladaptive, I mean the person is using a coping mechanism that seems to be working for him or her, but then it has a negative effect, some form of a negative effect on the person. So when we say psychological trauma, this is what we are looking at. To what extent has a person experienced something, and to what extent is the person's coping strategies either affecting them negatively or not being enough to sustain them, right? So that's basically psychological trauma. But trauma happens in various forms. There are different forms of trauma. Okay, and what we typically know about trauma is post-traumatic stress disorder. So maybe if a person experiences maybe a robbery attack or a vehicle accident, or maybe something very tragic like losing a loved one, in a tragic way, right? Then we usually will say that the person is more or less traumatized or may have been traumatized by the experience. But then it's not enough. There are various forms of trauma, and that for me is significant because these various forms of traumas actually affect us deeply more than the typical post-traumatic stress disorder, right? So one type, apart from the post-traumatic stress, there's one type of trauma called complex trauma. Okay, and complex trauma is when a person experiences multiple or varied forms of interpersonal trauma. So when we say interpersonal trauma, these are traumas that happen as a result of our interaction with other people. So think of it as, let's say, maybe right from a growing up age, a person goes to live with an aunt, and then they have a very, turbulent situation. They are called names, they are insulted, they are beaten, all of that. And then the person is moved to live with an uncle, and then the uncle also becomes very, sexually assaultive of the person. And then the person is moved, or maybe the person by that time goes to SHS, and then in SHS there's bullying. Okay, and then manages to finish SHS and goes to uni, and then in uni the person experiences maybe very bad breakup. Okay, and then after uni maybe the person also goes to work and then now has to deal with a very difficult boss. That those different experiences which can overwhelm that person is what we call complex trauma, because there are multiple traumas spanning different seasons of a person's life. Yeah, so that's what we call complex trauma. And also because most of these traumas are interpersonal. Okay, they happen between a person and another, as against typical PTSD, which may be just as a result of a road traffic accident. Okay, so that one is not because of another person, right? Or even though it may be because of another person, it's not because of a relationship with another person, right? So there's that. So there's complex trauma, and then there's chronic trauma. Okay, so chronic trauma is trauma that happens repetitively. Okay, those are verbal abuse. Okay, there's no sexual, but the verbal abuse spans almost all their lives till they leave home. We call that chronic trauma. It may not take the shape of a complex trauma because it may not be varied. But then, because that same trauma happens over and over again, we call that chronic trauma. And then there's developmental trauma. So for developmental trauma, these are traumas which happen at specific growth stages of people's lives. And if I mean more specifically in the life of children. Okay, so even if you're an adult and you did experience some trauma very early in your life, let's say from birth all the way to age 7, and sometimes into adolescence anyway, you may say that you've experienced developmental trauma. And sometimes people wonder how true that is. But in my practice, I've seen quite a significant amount of adults who experience developmental trauma. So let me give you one good example. So a mother comes to me with obvious mental health challenges, and she has a baby, and the baby is just about at the time the baby was just about 6 months, and she said to me that whenever the baby cries, she would pinch the baby so hard, and just so that the baby will continue to cry, even though the crying annoyed her. It's more like she was punishing the baby for crying. Okay, and of course, for those of us in the mental health field, we obviously will know that she probably was experiencing something postpartum, okay, either depression or psychosis. But that's the focus of what I'm saying is that this child even is 6 months old and was pinched. The mom also said that sometimes when the crying was unbearable, she would just go put the child in the hall, okay, and lay in bed till the child practically stops crying, okay. And of course, we are talking about trauma, so um, this is just by way of helping all of us. If you feel very triggered, feel free to put up your hands. We'll do a quick exercise, and then we'll continue the conversation. It can be triggering talking about trauma, and one of the things to do is always to pause and help each other find ourselves, and then we continue. Again, if you find it too triggering, you can put up your hands. But after this session, you think you want to talk through something or you need an intervention for something, I definitely owe you some interventions if you want to work with me. Otherwise, I could always recommend somebody who could help you. So yes, that's just by the way. So yes, so this mom leaves the child, comes into her room until the child, either falls asleep or stops crying. And little did she know that the child was actually being traumatized, because then she went on to say that now the child has stopped crying. Okay, so the point I'm making is that that's a form of developmental trauma. So this child may grow up never really having knowledge that they've been traumatized, because at 6 months, memory formation has almost not begun. But then our body stores memory, okay, our cells store memory. So this child's traumas may show more physiologically, and we'll get there. So the point I'm making is that there's also developmental trauma that we all need to be aware of. And then also there's vicarious trauma, which is what most medical professionals, especially for those of us who are in the mental health space, will usually experience. Okay, vicarious trauma. You are dealing with the patient, and you find that the patient tells you things that are too much for you to bear at some point in time. Okay, so that's vicarious trauma, like being traumatized by the trauma of others just by observing or hearing whatever the person has experienced. Okay, so and I'm a victim of vicarious trauma because of the work I do. I hear a lot of things that can be very difficult to shake off sometimes, but of course it's part of the hazards of my job. Yeah, and we find a way around it. So that's vicarious trauma, witnessing the traumas of others. Okay, and then the final one, there are other two, but I'll limit it to just these ones. And then the final one is what we call small t trauma. So small t traumas they may fall within the category of a complex trauma, but then what may make them different is that sometimes it may not necessarily look like a trauma. It might just look like stress, but then this stress is repeated. So, for example, someone says that she was made to clean the kitchen usually after 10 p.m. because that's when everybody will finish eating. And I'm talking about somebody who is a teenager. And this had to happen over and over and over again. Okay. And she couldn't complain because she lived with people. Okay. This may not look like a trauma, right? Because I mean, we all do house chores. So what's your problem? Okay. But the point is that, like I define psychological trauma, the person's coping strategies could not help her deal with her traumas. And so the whole idea of staying up just to wash the dishes to go to bed, whether she has homework, whether she has an early morning class, whatever it is, uh, could be considered trauma because or traumatic because this person may always dread the evening coming. Okay, that once it's 6 p.m., the person begins to feel the dread that, oh goodness, I have to stay up all the way to 10 p.m. and all of that, and that could be traumatic. So that's why those are the things we call small t traumas. They may not look like trauma, but they may be repeated or they may happen over a long period of time, and over that stretch of time, the person suddenly feels overpowered by the situation. Again, another subtle one may be, we used to make fun of the fact that, I mean, back in the days, people have their fathers coming home and everybody will run, and go and hide because daddy is coming home. But that even though may be something to laugh about today, may have traumatized some people because someone say, but he didn't beat you, but he didn't do anything. But the dread that this person is coming home, the fear, okay, the shattering fear could be called trauma. So these are the types of traumas I think we should get acquainted with today. The examples are just to bring the idea home to all of us. 1 or 7 out of 10. So I just quickly want to go onto the call log. There are 22 of us on the call. Okay. And so in essence, we are saying that 10 or more of us, okay, may have experienced at least one of these types of trauma. If I want to really do a proper assessment, I may say that out of the 22 of us, there's the possibility that 14 or 15 of us may have experienced one of these. And that is what makes it important. Can you imagine 22 people on a call and 15 have experienced a trauma, one form of trauma or another? That is very significant. And think of it as, now stretch this figure to maybe your church or your denomination. So if there are 100 people in your church, we are talking about 70 of them or 70 people in that congregation having experienced some form of trauma. Stretch it to a lecture hall. Okay. So let's say it's one of those traditional lecture halls of 500 people, So, I mean, I'm sure by this time it's coming home. Take it to a home. Okay, take it to a family or a household of 6 or 7 people, and you'll find that a significant number, definitely 2/3, may have experienced one form of trauma. And that is why trauma is important to talk about. That's why we need to get down to it, to understanding it for various reasons. One is to ensure that we prevent because of what we know, and then two, to ensure that we promote the knowledge of it so that we can be empowered to deal with it among ourselves, and then three, so that we can support each other in getting the needed help, right? So this is what makes trauma important. In my studies, what became alarming to me when I was in specialty training was that I realized that in my community alone, where I grew up, which I mean by God's grace was you may say middle class. Okay, I mean world homes. Everybody had some level of luxury. If I would say, okay, but even at that, in my training, of course, this is in hindsight when I'm looking back at where I grew up and all my friends in the neighborhood, I could count 10 houses and I would find at least 9 of them or 9 out of the 10 on that stretch where somebody was possibly experiencing a trauma. Okay, and nobody sort of knew about it. So the point I'm making is that this thing is with us. This thing is a whole pandemic we are dealing with, and I thank God that we are able to talk about it in nowadays, and particularly for a program like this. So this is just to bring home the idea that we have a common enemy, and we need to join forces and fight this common enemy. Now, so someone would then ask, how will I know if indeed I've experienced a trauma apart from the event that I may have been exposed to, apart from the fact that I wanted to talk to someone at a certain point in time and I never really got someone to talk to, apart from the fact that I have very difficult relationship issues, whether marriage or whatever, and it keeps me at night. It keeps me awake at night, and I don't know who to talk to. Like, apart from these experiences, what will make me know that I'm experiencing trauma? So I've grouped the symptoms into two types. Okay, and two types because I think that is they are subtle, very very subtle traumas. Okay, very very subtle signs of trauma. Let me put it that way. So if I say subtle, what I mean is that you may never realize that um, this is as a result of trauma. What you are showing is as a result of a trauma you have experienced. Okay, so let's go through some of the very, very, very subtle signs. The first one is anger. Okay, when you feel angry about little things, or when your anger is the rage type of anger, when you react quickly and now you wonder why you did what you did. That may be a very subtle sign. And then also I spoke about pain. When you have various forms of pain, typically headaches. Okay, headaches without any medical condition, maybe a malaria or whatever, headaches without BP rising or dropping. Okay, when you have headaches that are almost unexplainable, that could give an impression that probably may have experienced some form of trauma. And then I mentioned when we have relational issues due to mood changes. Okay, so when you have relational issues due to mood, people wonder which mood is she or he in. Can I talk to him now? Do I have to wait? So when people sort of have to read you all the time to determine whether you are accessible or can be engaged or not, is a sign that there's some form of you may have experienced some trauma. And then also when there's very low self-esteem, okay, and low self-esteem can show in very subtle ways. So let me give you two clear ways. So the first one is when we we speak less of ourselves. We don't think we are capable of doing things. And the very obvious low self-esteem when we feel like we need approval of people all the time to feel that we've done something great, stuff like that. Now, there's another twist to low self-esteem, which is very difficult to determine sometimes. This is when we are overly confident. Okay. So one will wonder, how can overconfidence be a sign of low self-esteem? So when you feel like you need to prove yourself all the time, you need to speak proudly and strongly and courageously, it's could actually be a sign of low self-esteem, because on the most part you want to protect a part of you. Okay, there's a part that wants to be seen, okay, that wants to be heard and valued, and that could actually be a sign of low self-esteem. It means that intrinsically, or at a very subconscious level, you may be struggling with yourself. Okay. And then also low self-esteem could show in insecurity. Okay. When we're always questioning why someone was picked over us, why somebody is celebrated and not us, when we gossip a lot about people just to feel good, all those are signs of low self-esteem. And by extension, signs of some form of trauma. And then also when there's avoidance, okay, so when there's avoidance of people or reminders. So when we feel like, oh, I don't want to talk about this, I don't talk about this. When there's always, I don't want to talk about this, that could be an indication that you may have experienced some form of trauma. So these are the subtle signs of trauma. Now there are the profound signs of trauma, or the more pronounced ones, the ones which may be very obvious to all and to self. Okay, and this may show in hypervigilance. So hypervigilance basically means for those of us in the psychiatric world, we may also consider that as a bit of paranoia, right? So when we think people are talking about us, hey, who is that? Why is he looking at me that way? Is she talking about me? She's been looking at me, that kind of thing. That may not necessarily pass for paranoia if we are looking at paranoia from a psychiatric lens. There may be other things we probably would look at. But if this is a lone ranger, this is more like this stands alone, like hypervigilance stands alone without any other causes, or not causes, any other signs of paranoia, then we may say that that may be a sign of trauma, a profound sign of trauma, because hypervigilance can make us reactive. Okay, so why is she looking at me that way? And then sometimes we want to confront the person. The last time I saw you looking at me in a certain way, do you have any problem with me? Okay, that is profound because it comes with a reaction. And then also hypervigilance could show in avoiding people and places. So we have a meeting and there's a particular group of people or persons. Because of them, no, I'm not going. I'm not attending that meeting. And even if it is very important and will help, we still avoid it because we can't deal with certain people. That's also a sign of hypervigilance. And then when there is dissociation, so dissociation is when you notice that you go away in your mind so many times. Okay, you're almost always absent-minded. It's like there's always a conversation going on in your head that prevents you from being present, at a place. And then also when you always sort of become blank in your mind, like you don't know what's going on, then you catch yourself. And on the most part, people will tell you that I noticed that you don't, when I'm talking to you, you almost always have to catch yourself, like, okay, what were you saying? Okay, that kind of thing. It's a sign that you may have experienced some form of trauma. Again, dissociation can be very, very subtle. So in cases where people, you notice that you have a lot of memory lapses. Okay, you don't remember parts of your childhood. You don't remember parts of your, it's very, very significant parts of your life. You don't seem to remember. You don't remember significant people in your life. Okay, people always have to point out, oh, don't you remember that experience? We are like, you are just not there. That's a sign of dissociation, and it's also by extension may explain, or may be that you may have experienced some form of trauma at some point. And then panic attacks from nowhere. So it is very interesting because a lot of people for the past few weeks, quite a number of my patients tell me they experience panic symptoms from nowhere. Okay, so I don't know why. I just suddenly feel my heart. It's like I'm choking. I can't breathe. My chest is tight, and it feels painful. And I'm breathing very fast, like I'm gasping for breath and palpitating and all of that. So that may be a sign of trauma. Now, you remember the story I told you about this mother who used to pinch her daughter, 6-month-old daughter? That child can actually grow up and have panic symptoms without memory of it. Okay, again, because they don't know that something traumatic like that happened to them. So panic symptoms, out of the many reasons that could cause panic symptoms, one of them could be trauma. And then nightmares. Okay, constant nightmares, always having bad dreams, having dreams that take you back into your childhood, dreams that make you fight, dreams that disturb your sleep for days, for months, for years. Excuse me. Yeah. So those could also be signs, profound signs of trauma, as well as flashbacks. Okay, funny flashbacks. Okay, sometimes you just there and your mind just takes you back to that room, that person, that voice, that look, and then you suddenly feel like, I don't want to have this, and then you sort of zone out. Okay, or when you notice that you almost always want to stop the noise in your head, so constantly listening to loud music, you're constantly on social media, always watching something, okay, always buying something, always giving something, always requesting something. All those may be signs of trauma. Of course, these things do not stand in isolation. So all that I've said, they may be, if they are one-time experiences, we may not say that they are stemming from your trauma or from a trauma. But then if these things have persisted over time, you notice that you've traveled with them over a long period of time, then they probably may be rooted in a trauma. Right. So how do these things impact us? At this point, I'm sure your questions may be coming through. And so if you have any questions, please feel free to put them in the chat space as we progress. So how do traumas show? Right. So most I have realized again in my practice that people come to the hospital, they do all manner of skin tests, they do all manner of allergy tests, and they still have that skin problem. Okay, so from a dermatology standpoint or a skin standpoint, trauma can show in our body. Okay, so when you have, and how do I put this? A very stubborn skin disease. Okay, maybe that's a bit like one that is resistant to treatment. Okay, you've tried everything and it keeps coming. It may be a sign that something in your body wants to speak. Okay, your body is speaking to you, or something your body wants to find expression. So skin conditions like acne, like psoriasis, and the rest may be really, really either traumatic stress induced or trauma, whether chronic trauma or complex trauma or small t trauma induced. So that's one. So skin conditions are one of the ways to tell evidently whether you're experiencing a trauma or not. The other one is gut problems. So a lot of us may have experienced, you know, ulcers. Okay, a patient was telling me, I don't know where my ulcer went. I was like, okay, well, there's actually something called functional ulcers. So people who have experienced traumas sometimes have very severe abdominal pain that may mimic an ulcer, and you may do an endoscopy and you may take all the medications and it still doesn't resolve. You may want to check whether this may be due to a trauma. People also may experience serious indigestions, okay, acid reflux, abdominal pain, digestive pains, digestive issues, and all. On the most part, if you've tried treating them medically, or even if you haven't tried, you've done various tests and most of the tests are negative, then you may want to check whether it's coming from an unprocessed emotional trauma. So gut issues are one, another, and then people who experience autoimmune diseases. Okay, we are told that you have an SLE or myasthenia gravis, all those ones. On the most part, you may want to check whether you've experienced any trauma or whether they are precipitated, like your symptoms usually show after some form of stress. So the thing about trauma is that it affects our stress response system. And so even if you are not experiencing the trauma now, anything stressful can compromise your body in a way that can trigger a reaction. Okay, and a reaction that can be associated with a trauma. So autoimmune diseases are one. So if you've experienced that, if you've been diagnosed with an autoimmune disease and you've never had a psychological assessment for trauma or traumatic stress, then you may want to consider doing an assessment. And then also cardiovascular conditions and then sleep conditions. So from a physical health standpoint, these are the various manifestations of a trauma. Health, most of us may know about French depression. Depression is the baseline condition for anybody who has experienced trauma. Fundamentally, the person would experience some form of depression. Okay, it might show at different points. Maybe even if it's not a full-blown depression, it could actually be a dysphoria, okay, or a dysthymia. So this low kind of depression, 3 days, it comes 3 days, okay, you're in your room, you're not talking much, you're not eating much, your sleep is not too good, you feel very tired, you don't feel energetic, and then it spans for like 3 days, then it goes away for a day or two, then it comes another 3 days. And then when you are going through a very stressful moment of your life, maybe you have to take an exam or you are preparing for something, then it sort of hits you very hard. So you can go down for like 2 weeks, and then you pick yourself up again, go through the motions, try and take that exam, try and go to that school, try and do that thing. And then when all of that is down, you go back into a depression again. Now, all those may be signs of a trauma. So the depression is only telling you that something is happening underneath that needs to be sorted. And then another friend of ours that shows up after prolonged trauma is anxiety. I spoke about panic symptoms. So this sudden fear of the unknown. Okay, when you have this fear of being in places, fear of talking to people, and all of that, those could also be signs of trauma. And then one that most of us may not realize is substance use. Okay, so present data is pointing us to substance use actually being a sign of trauma. And of course, because on the most part, people use substances as a way of numbing their feelings. Okay, so those who are smoking or drinking or indulging in certain things, maybe doing that because it is helping them in a certain way. So when you ask typically people who are doing AA classes or people we are seeing because of maybe Korsakoff syndrome or liver problems and all of that, usually when you take the history, you would find that the person had a struggle at a certain point in time that was never really addressed. And then the person started numbing with the alcohol. And then now the alcohol became like an antidepressant. So they always take it to take away whatever emotions they were feeling, right? So substance use is the same goes for those who may be using marijuana or maybe taking cookies. Find that there's some trauma. Even those who, for those of us who are clinical, like, going to have to screen for trauma because on the most part, at least with the patients I have had to deal with, or staff who have some of these medications I've had to deal with, on the most part, they may be going through something traumatic or they may have experienced a trauma and these medications may be soothing them in a way. And then also personality disorders. Okay, so if you mostly, I mean, now it's become very, very common. People suffering borderline personality disorder and mood disorders like bipolar and the rest. Even schizophrenia has been found to have roots. Some forms have roots in trauma. Okay, or they were triggered by a trauma. Let me put it that way. So yes, these are the things that from a medical, those of us who are very clinical medical, even if you are not, just by way of information, if you are experiencing any of these things, you know somebody who is experiencing any of these things, but the person has never had to do an assessment for trauma, or the person has never had the chance to talk about their trauma, it will be great to invite the person for such an experience. Okay, yeah. And then I'm wrapping up now. So the trauma in relationships. So basically, another way trauma will show without necessarily a physical health issue or a mental health issue is relationships. Now, relationships are interestingly the first way of detecting whether a person is experiencing trauma or has experienced some form of trauma or not. So let's take note of these 4 or 5 things. First one is if you don't trust people, people say it leisurely. Okay, I don't trust anyone. I don't trust anyone. If you find it difficult trusting people, there's a chance that you've experienced interpersonal trauma, whether it's chronic, complex, or small t. You may have experienced some form of interpersonal trauma. Why is that? So someone says, "So should I go about trusting people?" Not exactly. I know that people must earn trust, but on the most part, when somebody has been traumatized or has experienced some form of trauma, even when it doesn't warrant not trusting another person, they still can't bring themselves to trusting them. They always will not be able to trust. Okay, and this shows in various ways, like you are dating and then you find that you are dating one person and you're talking to another person because you feel that this person can leave you at any time, so you just sort of need a backup. Okay, that is a clear sign. And then when we have boundary challenges, okay, so when some people may set very strong boundaries. Don't touch me. Don't come close. Why are you talking to me like that? Um, Stuff like that may be indicative of some form of trauma, but maybe showing relationally. Okay, so when people are very sensitive about their space and about their items, their possessions. Okay, why did you touch this? Why did you touch that? And sometimes, I mean, a number of onlookers can tell that, oh, I mean, you can let this pass, but a person can just not shake it off. Why did you do this to me? Why did you speak to me like this and all of that? And it's difficult for the person to shake it off. That is a sign that the person may have experienced some form of trauma. So those may speak to strict boundaries. Okay, very, very strict boundaries. Don't talk to me like this. Address me by my title. Stuff like that. Okay, may be indicative of some form of trauma. And then when the boundaries are very low, okay, so when anybody can say anything, then you can do whatever, and whether you touch them or you do whatever, it's always about maybe using humor. Oh, don't touch me like that, but they still allow it, and then they will go and cry about it. But then whenever it is being done to them, they find it difficult to say, don't do this to me, in a more responsible way. So that's when the boundaries are very, very low. Someone will take your item and you feel you want to talk about it, but you can't seem to find the words to talk about it. And everybody says, why don't you address it? Talk about it. It's like, there's no problem. No, it's not a problem. But everybody can tell that it's eating you up. Okay. That's a sign that there may have been some form of a trauma along the line. So boundaries are also an indication of the possibility of someone having experienced a trauma. A friend of mine, or someone was telling me about how another friend cannot just stop talking. Okay, so you have a conversation with him or her, and I'm trying to be discreet about it. So a conversation with him or her, and the person just the next moment talks to this person about it, talks to that person about it, talks to that person about it. Meanwhile, this conversation was supposed to be between both of you, right? So that's a clear issue of boundaries. And normal as that may seem, because we see it all the time, it would actually be rooted in a trauma. Okay, so yeah. And then number 3 is the fear of abandonment. Okay, so when people feel, hey, don't leave me, why didn't you call me? You said you call me, you didn't call me. When you don't communicate, it gets to me, which may be legitimate, but then sometimes it's overstretched. Okay, so a fear of abandonment could also be a sign of trauma. I can't be alone. You need to spend time with me. All those kinds of things, okay, may be a sign of trauma. Now, abandonment could also show in another way, which may be very interesting. So, when a person is very uptight, I don't need you. I don't need anybody. Highly independent person. I don't need anybody to survive. Fixes everything by themselves. They don't depend on anybody. It could actually also be a sign of a fear of abandonment. Okay, it is just to be in control so that they are not disappointed. So, if a person is on the extreme side of it, where they can't trust anybody or they can't allow anybody into their space, and delegate things or delegate a portion of how they feel to another person, as it were. If I say delegate a portion of how they feel, like allowing other people to also influence how they feel, if a person cannot do that, then there could be a fear of abandonment. So they're always uptight. They ensure that they don't build a relationship with another person which will affect them. So they are very superficial. Stuff like that. You don't take anything from them. Keep your thing, I keep my thing, kind of thing. May communicate some form of a fear of abandonment. Apart from the other one, which is the needy part. So the other side is being needy, is being always needing people to say something, to love you, to send you wishes, to say good morning, always needing something is also a sign of a fear of abandonment, right? And then I guess because of our time, let's wrap up here. So, and then finally, when you have challenges with parenting, okay, so for those of us who have kids or who are married, when you warn your children about things, okay, someone said to me that she warned her children that when they get married, they should make sure that they don't show that they are strong to their spouses. So always be weak. Be weak about everything. Even if you can do it, tell your spouse you can't do it, right? So this is how trauma shows in parenting. We pass on things, right? And this person was speaking from her trauma because um, she felt used all her life, and felt that until you manipulate people by pretending not to be able to do things, they will always have you do things. Okay. And that is strongly rooted in trauma. So the way we parent our children, that is on one breath, making our children act in certain ways. On another breath is when we think that you have to be strong. You have to be strong. Life is not for the weak. Wake up and do this. And then we are very, hard on our children. We want to mold them into something. It's a sign that we are running away from our trauma, or we are trying to undo what happened to us, right? So some people will not accept anything less than coming third. Once you are fourth or fifth, you can't be celebrated. Once you are not top of your class, there's a problem. All those kinds of things may be rooted in traumas. So the way we parent our children, and then finally the way we relate with our parents or even our guardians may be a sign of trauma. Some of us, or some people who have experienced trauma, may experience estrangement. So estrangement basically means I don't talk to my parents. I don't talk to anybody uh, from my family who was a guardian to me, right? So there's no conversation whatsoever. And then sometimes, even when this conversation is out of duty and it is very, very brief, that could also indicate that a person may have experienced trauma. So again, you find people who will call their parents once a week and it's out of duty, and it's just because if they don't, a complaint will come from someone, and then when they call, it is hello, how are you, do you need anything? I don't need anything. Okay, I'm at work. But they probably are home and they'll say, I'm at work, I'll call you later, and that's it. So out of duty relationship with parents and out of duty relationship with children may be indicative of a trauma, right? At this point, let's see. I've shared a lot of bad news. Let's talk about good news. So, how do we deal with these things? How do we mitigate the impact of trauma on ourselves, the impact of trauma on our loved ones, and all of that? So, the first one is that what you don't know can kill you, right? So, it's always important to identify. The thing about trauma is that trauma can make people behave like ostriches. Okay, we just bury our heads in the sand, see no evil, hear no evil, and all of that. We don't want to see it, we don't want to hear it, kind of thing. But what you don't know can kill you. Excuse me. So the point I'm making is that this conversation is important. At least you may have heard something you can relate with, or something a dear one of yours maybe experienced or may have experienced that you've noticed. So the first way to deal with trauma is awareness. So knowing or recognizing, yes, I feel this way. Yes, my sleep is poor. Yes, I have gut issues. Yes, I have pain issues. Indeed, my relationship with my husband is traumatic. The way he speaks to me make me cry all the time. It is true. I'm not denying it. I've been traumatized. This person has done this to me. There's nothing wrong with being or having experienced a trauma. Okay, once we accept that, once we are aware that something has happened to us, the journey begins. The journey towards healing begins. So awareness is very, very important. Number two is that trauma has a very interesting way of affecting our health. Okay, and um, presently, data tells us that 8 out of 10 people who go to see a family physician or a general practitioner, a medical doctor, okay, may have experienced a trauma. Okay, and the physical signs, whatever reason for it they went to see the doctor, may be due to a trauma. The point I'm making is that now we are eating well, most of us, at least because of what we know. Now we are exercising, now we are trying to be healthy and all of that. So why are we still sick? Right? That's the big question we need to ask ourselves. And on the most part, we usually will fall sick because there's a trauma compounded by a stress or a traumatic stress, and then that lands us in the doctor's office. And then largely you would also find that we do all the tests and everything comes out negative, right? And yet we are still sick. So um, the way trauma and traumatic stress impacts our body the next thing to do is to keep a solid self-care system. Okay. And self-care must be comprehensive. So self-care means that you make sure that if you've experienced at least two, okay, if you've experienced two traumas, maybe you were physically abused, okay, you were beaten, slapped by a parent, stuff like that, or a guardian, whoever the person may be, or you were neglected, okay, you grew up at a certain phase of your life, you felt so unloved, so unloved, okay, and you felt nobody noticed you, nobody cared, right? If you have experienced just these two, you've experienced a trauma, or you've experienced traumas. And on that note, that just these two can compromise your immunity significantly. So, keeping a very healthy life is crucial. So, drinking water, staying hydrated is no more going to be like something we just say. It now has to be a way of life. Like staying hydrated now becomes like medication, right? You need to stay hydrated to be functional. And then also, you need to eat well. Okay, you need to eat very well. You need to prioritize your exercises, and then also prioritize your moments of being with yourself, being alone, and comforting yourself in a certain way, whether it's sleeping or reading or a hobby or something that keeps you calm and calm and cared for, right? So that's it. So self-care is a crucial part of the healing process. Self-care is what I meant by all that I said. Number three is to make sure that you keep a very strong social support system. Okay. If I say strong social support system, make sure that even if you have that one friend who understands you, that who loves you for who you are and recognizes your weakness, your frailties, and still appreciates you, tells you the truth in the face, but still comforts you afterwards, make sure you keep that friend. Make sure you spend time with that friend. Make sure you offload to that friend. Tell the person and allow yourself to be loved by this person. Because on the most part, again, trauma prevents us from enjoying love. Okay, when someone is loving us, we tend to think that, hey, what does he want from me? Is he sure she really is he or she sure he really loves me or he wants something from me? So trauma can make us, like I mentioned way earlier in the presentation, hyper vigilant. So you are looking for what else someone else wants to do to you, right? But enjoy the love of genuine people and allow yourself to be loved. Number three is to ensure that you build your boundaries. Okay, ensure that people who can harm you are kept at arm's length. And on the most part, to determine who can or cannot harm you, you need to have a good conversation with somebody who truly understands you. Because sometimes you may feel that someone can harm you, but they truly may not want to harm you. It's just the way you feel. Other times, the person can truly harm you, and you would need someone to say that, look, don't engage this person because if you stay any closer, this person will take advantage of you. This person can harm you, right? So the point I'm making is that let's build, after you've built a strong social support system, also build boundaries that are protective of you. Number four is that ensure that you have created safe spaces. Okay, one safe space can be what Matt and his team are doing, right? So if this is a monthly conversation that goes on, it can be a safe space for you. You pledge to yourself that every month I'm going to join this conversation and learn something new. So that's a gift you give yourself every month. Another safe space for those of us who may be people of faith is to go to church. So deciding that I love being in church. I love the music. I love the dance. I love to hear the word of God. And deliberately, okay, making it a therapeutic process. Apart from it helping your salvation, you also make it a therapeutic process. So you go to church and then you dance and then you sing and then you make friends and you laugh off and you go back home. That can be a safe place. If you have some wonderful group of friends who love to travel or who love to sit out and hang out and go hiking and all those things, go walking, if there's something like that, like a kid fit, like a gym, it can also be a safe place. So you join that and then you ensure that you are in it. You know, you're part of some form of a community. It may not be a community where you can share your experiences or what you are going through, but it may just be that community that allows you to be yourself within a certain frame of time. Right. And then maybe the last one, because it's almost 3 and we need to go. So the last one may be going for therapy, okay, or seeking some form of help. If you've experienced any of the traumas, or you know someone who has experienced some trauma, my best bet has always been going for therapy. Okay, just go get checked, right? Just go and have a conversation with a professional and hear what they have to say about what you've experienced. Someone said to me that um, if you go if you go searching, then you would find. Okay, so if I don't search, I don't know, and if I don't know, I'm fine, right? But the truth of the matter is that on the most part, what you don't know is also what kills you, right? So you may just be postponing death, right? I mean, I'm speaking figuratively, but the point I'm making is that it's always good to get checked and to ask the questions and to understand what's going on with you. So let me wrap this up with a very simple experience I got with a young lady. So she's permitted me to share her story because she found it revealing herself. But I won't give details. I'll just tell whatever we're working with. So I met this young lady somewhere casually, and we had a conversation. And then she started telling me about her experiences. And then I asked her whether she knows about trauma. And she said, oh, she's heard about it, but she doesn't really know about it. And I asked her, what do you think you have experienced trauma? And she said, no, of course not. She doesn't think so. Then I told her, okay, this is what I do. And I actually think she's experienced trauma. And she's like, really? I mean, I should explain to her. So I explained to her why I felt she had experienced trauma and what some of the things she may be experiencing now could be. So when I told her that I'm sure you struggle with your sleep, so I just gave her a bunch of things she may be struggling with for her to choose from. And then she checked all the boxes and she now looks at me and says, oh, how do you know all of this? I was like, well, I mean, it's not magic, it's science, right? Once you've experienced trauma, these things are bound to happen. Then I told her what to do, like I've just shared here. Now that she knew she had experienced trauma, she needed to work on her self-care. So I put her on a self-care program, and she started, working on it meticulously. And I told her that given the number of traumas she's experienced, there's a possibility that, I mean, from what the data says, she could experience inflammatory diseases, right? Or autoimmune disease. So a few months back, a few months ago, she just calls and tells me, Dr. Kumi, you won't believe it. They just found something in my breast. I hope it's not a cancer, stuff like that. And I told her, look, don't worry. We are working on how to reprogram your body. So there's nothing really to fear. Let's pray that it comes out great. But that time I had explained to her how trauma can affect our lymph nodes, how trauma can result in various growths in our body, okay, inflammations and all of that. So she went into her intervention with so much knowledge and she was so confident. And thankfully, when the whole biopsy came back, they found that the growth was not cancerous, thank God. But the point is that she didn't have to wonder where is this growth coming from. She knew that she had experienced so many things which can make her body struggle. And now she knows how to reverse it. So the point is that when we go for therapy, even though this young friend of mine's experience was just, it just happened. When you go for therapy, especially with somebody who understands all these things, the possibility that the person will be able to pick up a few things for you is very high. And it's not to scare you, it is just to arm you enough to protect yourself, to help you live longer and healthier and more fulfilled lives. Yeah, so that's how I want to end my presentation. Thank you very much.
Wow, thank you so much, Doc. That was very powerful. In fact, being inspired, but also being informed well. I never knew trauma has so many tentacles like that they can affect our lives. We are so much grateful. Please, time for questions, any clarification, any concern. The floor is open. Just raise your hand. We'll call you so that doctor will address your consent. Before that, my own quick one. Doc, please, how can we identify a trauma in the 1 year or 2 year old child? And is it possible that they also go through trauma?
Yeah, that's a good one. So yes, I mean 1 year, 2 years, 6 months, 2 days may all experience they could experience trauma. So look out for these signs. Normally, for a child who is a year or two, the child must be carefree, right? Um, the child must enjoy life, have little worries, cry a bit and stop a bit, and play a bit, and all of that. Now, when you see anything that is quite off normal growth or development, you should be concerned. So, a 1 year old child, 2 year old child who doesn't talk much, avoids playing with other children, um, doesn't cry at all, okay, or cries incessantly. So usually by age 2 tops, a child should be able to regulate their cry. Okay, so they should be able to cry and stop, and sometimes right after stopping, if they got what they want, just laugh it off and move on. But if a child is very difficult to console, they cry incessantly and nothing seems to keep them calm, then they probably have experienced something that we need to look into. If the child is also having very very difficult sleep, okay, child just um, shouts in the sleep, cries in the sleep, has to hold you so tight. I mean, typically when children wake up at night, once they see their parents, when they can have contact, they go back to sleep. But if this child practically wants to find some form of safety in you, then they may be struggling with something. If the child falls sick without reason, of course, children pick infections, especially when they start school. But when you find that the child is almost always unwell, fall sick, you treat, fall sick, you treat, you may be dealing with something. Another one, if the child shows some form of absent seizure, okay, you notice that the child sort of trembles like he or she is getting or experiencing some form of a seizure. Okay, it may not come with drooling, but the child will just tremble and then stop, and then tremble again and then stop, and all of that. It should tell you that the child's nervous system is trying to talk about something. All right. And then also abnormal temperature. Okay. Sometimes the child will spike, and then you give the child maybe a painkiller, analgesic, and then a few days the child spikes again. Right. It should tell you, especially if this persists for weeks. Okay, you treat, it comes back, you treat, it comes back. We find out that it's not an infection, nothing is going on, but the child keeps spiking. Then we need to investigate that. So these are some of the signs. Now we talk about autism and the like, but I have realized that on the most part, children, at least with the children I've worked with, children who are quite hyperactive, apart from it being a neurodivergent issue, ADHD has been found to be triggered by trauma. So if you have a child who is very hyperactive or attention deficient, or shows classic symptoms of or not classic, but like um, similar symptoms of autism, almost like an atypical form of autism, right? So the child doesn't talk and doesn't give eye contact, but the child also doesn't flap. Okay, there's no flapping, but these two signs are there. It's almost like an atypical form of autism. You may want to look out whether the child has experienced trauma, right?
Doc, thank you very much. A quick one, please. Is it possible we can link an adult who has grown to become very cruel to probably human beings and animals, that person might have suffered some sort of psychological trauma whilst he or she is growing up?
Mm. Can you take the question again?
The person is very cruel to animals.
Mm-hmm, mm-hmm.
Yeah.
Yeah,
We
yeah.
link it to, yeah, that probably when he or she is growing up,
They had a
he might
trauma.
have experienced some sort of trauma.
Absolutely, absolutely, yes. So yeah, and I've had cases like that. I had a patient who would find a kitten, a baby cat, and just murder the cat, and find lizards and stuff, gory stuff like that. But yes, so it's a form of how do I put it? It's a form of transference. Okay, it's cathartic. Too many science words. But the point I'm making is that this person possibly has homicidal tendencies, but there's the person knows that it is wrong, okay, or cannot met out that judgment to whoever harmed them in that way, and so they find a safe object to met this out to. It's the same thing with when people cut themselves. I mean, I can't cut you, so I would rather cut myself. And on the most part, it's not because it's not outrightly homicidal. Sometimes it's also just cathartic, like trying to express their pent up emotions in more acceptable or convenient, not acceptable but convenient ways. So yes, harming animals and harming ourselves are also clear signs of a trauma.
All right, thank you very much.